Hello and welcome to CSWE's Critical Conversations series. I'm Dr. Killian Kinney, one of the two co-chairs of CSWE's Council on Sexual Orientation and Gender Identity and Expression. Today, I am joined with Richard Brandon-Friedman, an assistant professor at Indiana University School of Social Work and assistant professor of pediatrics at Indiana University's School of Medicine. His academic foci include sexual and gender identity development among youth, sexual well-being among youth, sexuality discourse within social work, and addressing sexuality within the child welfare system. Welcome, Dr. Brandon-Friedman.
Thank you for having me.
Thank you. So I'd like to start with a discussion about your work that won you and your co-authors the 2020 CSWE Scholarship Award. And that article was entitled Sexual Identity Development and Its Impact on Sexual Well-Being, Differences Between Sexual Minority and Non-Sexual Minority Former Foster Youth. But before we get started on your work, I'd like to talk a little bit about the terminology used in the title. So the minority and non-sexual minority. Would you provide some background into why you and your co-authors chose those terms?
Yes, so first I would like to acknowledge my co-authors. My co-authors for this paper were Drs. Pierce, Waller, and Thigpen of the Indiana University School of Social Work and Dr. Fortenberry of the Indiana University School of Medicine. So when we look at sexual identity, one thing that I think is important is to understand that sexual identity is much more than sexual orientation identity. And I think those are two things that are conflated a lot. When I look at sexual identity, I'm looking at aspects of the youth's lives related to sexuality in a very all-encompassing manner. So this includes how they understand themselves as a sexual being. It includes other aspects of sexuality, and especially when you look at sexual well-being, we look at areas such as sexual satisfaction, sexual autonomy, ability to communicate about sexual desires, and of course, sexual health outcomes as well. So when we look at youth and how they identify sexually, what we often see is that we will identify heterosexual youth as the norm of sorts, and then compare non-sexual or sexual minority youth or LGBTQ youth against the heterosexual youth. And our goal was really to foreground the experiences of the sexual minority youth. And so what we wanted to do is use their experiences as the basis for comparison. So we wanted to know how their experiences were, and then look at if those are different from non-sexual minority youth. So it really was an attempt to flip the conversation around and use their experiences as the primary area of interest.
Excellent. Great point. So then turning to your research, would you explain the background of the study and why you chose to examine these topics?
So this work evolved out of my work as a therapist in therapeutic foster care. While I was a therapist, I found that many youth spoke with me about sexuality or sexual concerns, interactions they were having with others. And a lot of youth seemed to be coming to me for this information, and it made me wonder what happens if I wasn't willing to answer those questions. So I started doing a little research and talking to other people in the child welfare system. And what I found was that a lot of child welfare workers felt that it wasn't really their responsibility to address sexuality with youth. They felt that they didn't have the training to do it, and they sort of felt that it was more of the foster parents' role. When I talked to a lot of foster parents, they felt that it wasn't their role, that these weren't perhaps their children, or that they were completely unprepared to have those discussions. So then they decided to not talk about it. And then we had a child or school systems where you see a lot of sexuality education, but when you have youth in the foster care system, they may move around multiple times and they may miss that educational opportunity, as well as sometimes schools don't teach very comprehensive sexuality education. So in this study, we had a looking at sexuality, sexual discussions, relationships with professionals, and how these affected sexual identity development, and how this then impacted sexual well-being. So this part of the research that we're talking about here was really looking at differences between sexual minority youth and non-sexual minority youth, and really to see how their experiences within the child welfare system impacted both their sexual identity development and their sexual well-being, and what factors such as also trauma impacted those experiences.
Excellent. Why do you think there's so little information about the differences in sexual well-being and sexual identity development between these two groups within the foster care system?
I think there's a general lack of information and understanding about sexuality development within the child welfare system. This is an area that's getting a little more attention these days, although primarily the attention is looking at negative outcomes in terms of how do we avoid teen pregnancy, how do we avoid sexual victimization and things like that, which are all, of course, very important to address. But I think when you're looking at sexuality holistically, that's really missing from the conversation. And then when you look at youth in the foster care system, as I said, you have this dispersion of responsibility where a lot of people feel it's someone else's job. And then when you look at sexual minority youth, you have another layer of concern in terms of that a lot of people don't feel comfortable discussing these aspects of these youth's lives. So for individuals who may feel comfortable discussing aspects of sexuality, they may not feel comfortable talking about same-sex sexuality. So they may not feel comfortable discussing males who have sex with males or females having sex with females, or even gender diverse individuals having sex. So I think that's really an area that we don't look at. And again, with the foster care system, you also have state involvement and people being more concerned about whether they're saying the right thing. I think we also have a difficulty with research. Since there's not a lot of research on this area, there's not a lot of guidance for professionals. So it's one thing to say professionals should discuss this, but it's another thing to actually provide education to professionals on how to address these areas. And again, I think when you get to sex between sexual minority individuals, people really just feel much less comfortable discussing that, whether it's in the foster care system or with in families of origin. And I think that really just impacts the understanding of these individuals' lives.
Yeah, very meaningful points. So what do you feel are the most important findings from your research, but also why do you feel it's important for social workers to know this?
Well, we looked at a couple areas. One thing that we found that was really beneficial or exciting to find was that there was no differences in the relationship quality for sexual minority and non-sexual minority youth with their professional providers. So it was really nice to see that professional providers seem to have equal relationships with youth, whether they identify as sexual minorities or as heterosexual. Unfortunately, we found there was a significant difference in how the youth related with foster parents. So this is an area that's actually been examined for a good amount of time now, and this has been recognized as a concern. Unfortunately, it seems to still be a concern at this point, and that we need to do some better education with foster parents on how to engage with sexual minority or gender minority youth. In terms of differences in experiences, we found that sexual minority youth entered care earlier and left later, which gave them a significantly different amount of time in the foster care system. They were in care for significantly longer than non-sexual minority youth. We also found that they had higher levels of sexual victimization and higher engagement in transactional sex. So this is particularly concerning because when you look at youth that are in the foster care system or the child welfare system, many of them have already experienced a lot of abuse. That's how many of the youth end up in the child welfare system. But even within a population that has a greater incidence of abuse and victimization, sexual minority youth have an even higher experience level of victimization and transactional sex actions. And I think that really shows a lot of the difficulties that these youth have. In terms of sexual identity itself, we found that they had lower levels of sexual identity commitment, which is adhering to social norms in terms of sexual identity, which was not necessarily surprising because these youth have to process their differences from sexual norms and really understanding of how their sexuality and their sexual orientation differs from sort of the mainstream understanding of sexuality or what is normal, or at least normal based on societal norms. They had higher levels of sexual identity exploration, which again is not surprising. And then they had higher levels of sexual orientation, identity uncertainty. So these are all important to know, but really it's also important to know that all aspects of sexual identity development impacted their sexual well-being. So depending on where they fell on the sexual identity scales affected how their sexual well-being was. So that means depending on how developed their sexual identity was, had a positive impact on their sexual well-being. So the more they understood themselves, they had a higher level of sexual well-being. The more they had uncertainty about their sexual orientation, the lower their levels of sexual well-being. So this really, again, reiterates to us that sexual identity development is a critical component of these youth's lives. I would argue it's a critical component of all youth's lives, and I think we would see some of the same material if we looked at youth outside the child welfare system. But really, for youth in the child welfare system, we really have to focus on this sexual development. And part of that means that we have to be willing to discuss sexual development with youth in the child welfare system, and particularly sexual minority youth.
Absolutely. Great points. And thank you for that very nice overview of your work. So from what I understand, you're also doing additional work in sexual identity development and sexual well-being. Can you talk a little bit about what you're working on now?
At this time, I've started to look a little bit more at gender diverse youth and really looking at some of the intersections in gender identity development, sexual identity development, and then sexual well-being. So even as little as we know about sexual minority youth and how to increase their sexual well-being, we know even less about gender minority youth or gender diverse youth. And really, when you start looking at gender diverse youth, you really get a much more complex picture because you're looking at how their gender affects their understanding of their sexuality, as well as how that sexuality interacts with others. So these youth who are gender diverse can have some very difficult relationships with their body and feelings of negativity towards some of the aspects of their body. And so when you look at that, it really impacts how they understand themselves as a sexual being. And as I just noted, how you understand yourself as a sexual being can have a significant impact on your sexual well-being in the end. And so I'm really starting to look at how those three pieces interact within youth's lives.
Great. Yeah, I mean, it's clear there's that complexity between sexual identity, gender identity, and sexual well-being. Can you speak a little bit more about that complexity?
Well, I think that society in general has moved towards a better understanding of the lives of sexual minority youth and LGBTQ plus individuals, gender minority. I think there's a greater societal acceptance of youth, and with that has come some increased acceptance of the relationships that those youth have. But we really, again, don't have that sexuality aspect. I think it's more that people feel that LGBTQ people have positive support and people are willing to discuss that, but they really don't want to get into the questions of what these youth are doing sexually and how what their sexual outcomes are. So I think also when you're looking at LGBTQ plus individuals, you really have this question about sexuality education. Most sexuality education does not include sexual minority youth, and it rarely, if ever, includes gender diverse youth. So really what you have is sexual minority youth or gender diverse youth are sitting in this sexual education and really often not feeling that it relates to them, or having questions that aren't being addressed, such as how two men have sex with each other. And I think those are critical pieces of these youth's lives. We know that within adolescence is really the time when people develop their sense of themselves as a sexual being and a romantic partner. And so when we're not addressing those, we're not having helping youth to understand those, or they're feeling excluded from those conversations, it really has a negative impact on their sense of self and then their sexual health outcomes. And so I think this really is an important area of focus, because we know some of what can be said, or we know some of what youth could be told. It's just a matter of actually doing that in a situation that is not specifically LGBTQ plus focused, but really reaching a broad audience.
Great. So with everything that you've discussed about the importance of these aspects to the lives of these LGBTQ youth and their well-being, what do you feel, or do you feel like the contemporary focus on LGBTQ plus pride is having a positive impact on LGBTQ youth's lives?
I think it is, to a large degree. So when we look at the mainstreaming of these LGBTQ plus pride events, I think we're giving sexual minority youth, gender diverse youth, a better sense that society supports them. They are able to see others that are like themselves. They can see other couples that they may feel match their romantic structure. I think they also see a lot of gender diverse individuals, and so that can help them as well. I think there is a little bit of negative component to that, in that I think that as pride has become more mainstream, and as you're starting to see a lot of corporate sponsorship and turning towards really family focused events, I think they're losing a little bit of the individuality that has come with pride events. Now, again, I'm very supportive of all these pride events, and I think it's wonderful that families are getting so involved, because it really supports the youth, and it shows the youth how important they are and how important their family views them, and that they have acceptance. However, I think that in many instances, pride events or LGBTQ plus community centers really were places where some of these aspects of sexuality and individuality were discussed more. And I think that sometimes that is getting sort of lost in the mainstreaming process. In a way, it's almost maybe becoming a little more sanitized, in terms of that there's a sort of norm presented, and that norm may not fit individuals who do not feel they fit within the media presentation. So again, I think it's an incredibly valuable, positive thing that pride has become so mainstream and these youth can see supports. Although it is also notable that these are generally in larger cities. There's very little pride events and such in rural areas. And so I think that also does exclude some youth there. But I think it's important for us to remember those youth that don't feel as if they fit within the mainstream pride image, and also to remember to address some of those areas that are maybe a little more uncomfortable, and that pride events still need to address.
So when we think about this and the role of social workers in helping LGBTQ youth in their sexual identity development, their gender identity development, and their sexual well-being, what is our role in this?
I think that social workers have a very important role, in that they are often people that families and youth turn to for support. So I think number one rule for social workers and mental health clinicians is really being willing to listen to the youth and support them. And again, I think that needs to go beyond just saying, I support you, but really being willing to discuss those aspects of their lives. So in social work, we're taught how to address and talk about many areas, such as trauma or victimization, significant depression. But I think we don't do a great job of discussing sex and sexuality, period. And so I think that we need to look at that and how we can do that more. We also need to make sure we don't make assumptions about youth. So we may think that they are, someone identifies as gay, and therefore they must be only having sex with men, which may not be true. So we really have to individualize our treatment and look to them to understand how their orientation impacts aspects of their lives, but also those components of their lives that might be slightly different than what you might assume based on a label. And I think that also looks particularly for gender diverse youth, because when you start looking at gender diverse youth, traditional labels of sexual orientation may not fit with them, or they may feel they don't fit. They may feel that they don't fit within standardized gender roles. And so they're looking really at different relationship structures or different understandings of the way they interact with others sexually and romantically. And so I think we really do need to look at that, because without that, we really can't address the youth's lives holistically, especially during this critical period of their development. So I don't expect, or I wouldn't say that social workers have to be sexual ed experts, but I think we just have to be willing to have those conversations. And some things we would certainly refer to medical professionals or others, but I think we need to be willing to have that conversation and say, okay, you identify as gay, who might you be having sex with? What areas do we need to look at? And then again, with gender diverse youth, looking at how they might label themselves and what that means to them.
Excellent. So building off of what you just said, what suggestions would you have for social work educators to incorporate your findings and your work into our classrooms?
I think it starts with the tone of discussion, similar to what goes on in social work practice. I think sexuality and sexual health, sexual education is largely not included in social work education. There's a lot of research that's been done recently about the lack of inclusion of sexuality in social work education and then social work practice. And I think, again, without that, we're not really looking at individuals' lives holistically, whether they're youth or adults. With that, I think we have to have those discussions within the classroom. Now, sometimes it is very beneficial to have guest speakers come in, individuals who may identify as LGBTQ plus or have more experience working with these individuals. I think that is a critical component of working to educate social work students, but I think we also have to make sure that it is not just a one class aspect, one guest speaker, but really being willing to have those discussions in other aspects of social work education, which can include even just mentioning LGBTQ plus individuals in other courses. So when you're looking at maybe a practice course, just having an LGBTQ plus family in there, when you're just looking at mentioning that a family's coming to services, their sexual orientation may not matter at all, but you really need to, if you have it in there, it's a recognition that these families do exist.
Yeah.
So yeah, I think it's really just being open to having those discussions within the social work classroom, because once we are able to do it in the classroom, then our students are able to do it outside the classroom.
Absolutely. I mean, this is part of incorporating diversity throughout their curriculum, and it's clients we're all going to see. So as we close, what other steps, what are the next steps in your research?
Right now, I am looking at developing a study of looking at how sexual identity and gender identity intersect. So I'm setting up some focus groups to talk to gender diverse youth and have that initial dialogue of how would you feel comfortable talking about sex and sexuality? What would you like us to, how would you like us to refer to body parts, some of these interactions? So I think that's really the next area for me. And then looking at how these youth engage sexually, because we really just don't know very much about how gender diverse youth engage sexually. We know very little about how that gender identity development and that sexual identity development affect their sexual health. So we know they do affect it, but we don't know very well how it is, and we don't really know much about their gender identity development.
Yeah. And I'm assuming you're open to collaborations?
Yes, I would be very happy to collaborate with other researchers or social work educators, social work practitioners who are working in this area. I think it's critical when you look at research to get a diversity of voices, both from practitioners, clients, and then other researchers. And so I think I would be very happy to discuss these topics with anyone else.
Excellent. Well, Dr. Brandon-Friedman, thank you for spending your time with us and talking about these really important topics. I think many of us would agree that there seems to be some progress towards supporting LGBTQ plus youth more, but there's still a lot more work to be done. And as you said, to really address their lives holistically. So we look forward to hearing more about your work in the future. Thank you.
Thank you for having me.